Hi, I'm Dr. Jack West, and I am an associate clinical professor in medical oncology at the City of Hope Comprehensive Cancer Center, where I also serve as the clinical executive director for Access Hope, offering remote consult services for patients with cancer. I think that the key answer broadly is that it varies incredibly for all sorts of reasons. One, there are many different kinds of chemotherapy, just like there are many different kinds of food, and you can't generalize that food is typically like this or that. It's something that could be anything from fast food to a fine dining experience or, all sorts of things. And chemotherapy, in addition, can vary incredibly from extremely minimal or negligible side effects. Some chemotherapy is given orally, most of it is given by vein, but some regimens are far more challenging than others, and they have different requirements in terms of the frequency of administration. Many are typically once every 3 weeks, once every 2 weeks. Some are daily for several days and then stopping for a period of time and then resuming several weeks later. And in addition, patients can have quite varied side effects, even to the same medications. Different people process different medicines differently. And so while some regimens are anticipated to be more challenging than others in terms of whether patients will experience nausea or significant fatigue. Other patients may have a much easier time even with the same regimens. So the key to me is to say it varies incredibly. It varies based on what treatment within the broad realm of chemotherapy we're talking about. It varies based on what this regimen is likely to be like in terms of side effects for many people. And the results, even with the same regimen, differ from one patient to another. So to me, it is critical for patients to understand that just because their Uncle Fred in 1997 had a very difficult time with chemotherapy, that doesn't mean that the chemotherapy regimen that they would be hearing about from their own oncologist now, over 20 years later, is going to be the same. Even 3 or 5 years later, or even 3 months ago, because the chemo regimens may be very different. It's important to get as best an assessment as you can of the regimen that's being proposed to you for your particular situation and discuss that with your physician, and not to paint all chemotherapy with one brush.